Okay, I'm starting my CE for head, ears, eyes, nose, and throat. This is my blank sheet of paper. Sabrina?
Hi.
Hey, my name is Glenn Adams. My pronouns are she, her, and hers, and I'm a physician assistant student here to take care of you. This is me washing my hands. How are you?
Good, how are you?
Good. Is it okay if I take just a couple minutes to chart some stuff before we get started?
Go ahead.
Okay. Alrighty, Sabrina. So what brings you in today?
Having a sore throat.
Okay. I'm sorry to hear you're in pain.
It's okay.
Alrighty. When did you first notice the sore throat?
About 3 days ago.
Okay. And can you show me where in your throat it hurts?
Towards the back, up in here.
On your left or right side?
My left.
Okay.
A little bit of both, but mostly left.
Okay. And since it started 3 days ago, has it been constant?
Yeah, but it's worse in the mornings.
Okay. And can you describe that pain to me, the soreness?
I think it's like, it's not terrible, it's just any kind of typical sore throat pain.
Mhm.
Probably like more, I don't know, sharp.
Okay. And have you noticed any associated symptoms when you get that sore throat?
Yeah, I have to cough every once in a while, and I have a runny nose.
Okay. Have you noticed anything that makes it better?
No, not really.
What about anything that makes it worse?
Certain spicy foods.
Okay. And I know you said it hurts right here. Does that pain radiate anywhere else in your throat or in your mouth?
Not really.
Okay. And have you noticed any patterns with the sore throat? Other than it, like you said, it gets worse when you eat spicy food. Okay. And if you had to rate the pain on a scale of 1 to 10, 0 being not painful at all and 10 being the worst pain you've ever felt, where would you put it?
Probably about a 3.
Okay. And have you had previous episodes of this sore throat?
Yeah, I do. Just ever since I was a kid, I get them every once in a while.
Is it like a seasonal thing? Okay. And what season do you get it?
Usually when it's starting to get cold.
Okay. Okay. And you said you noticed it 3 days ago, so what made you decide that you needed to come in today?
I feel like it's just getting worse and it's not going away on its own, so.
Okay. Alright, ma'am. Alright, now I'm going to ask you a lot of yes or no questions. To start, have you noticed a fever with the sore throat?
Maybe a little, nothing bad.
Okay. And all the questions I'm about to ask you are in terms of the sore throat that you noticed 3 days ago.
Okay.
So have you had any chills?
No.
Have you felt fatigued?
No.
What about a general feeling of unwellness?
Yes.
Have you had a generalized feeling of weakness?
No.
What about appetite changes?
No.
Have you had any weight changes?
Mm-mm.
Okay. And then in terms of your eyes, have you noticed any eye pain?
No.
What about blurring or burning?
Nope.
Have you noticed any double vision?
No.
Have you had any discharge from your eyes?
No.
Any dryness?
Mm-mm.
Okay. Have you noticed any floaters in your eyes?
No.
Have your eyes been itching?
Yes.
Yeah. Okay. And have you noticed any like sensitivity to light?
I don't think so, no.
Okay. What about redness?
A little.
Okay. Swelling?
No.
Have you noticed any spots in your vision?
Mm-mm.
Okay. What about changes in how well you can see?
No.
And have your eyes been watering?
Yes.
Okay. In terms of your ears, have you had any ear pain?
Yes, on my left ear.
Okay. Alrighty. Have you noticed any discharge from your ear?
Mm-mm.
What about popping or pressure?
No.
Okay. And have you had any ringing in your ears?
No.
Have you felt like the room was spinning or that you were spinning?
Nope.
No. Okay. And have you noticed any like excessive earwax?
No.
Okay. Have you noticed that your like ears are really, really sensitive to sound?
Mm-mm.
Okay. Have you had any changes in your hearing?
No.
Okay. And have you noticed any, did I ask you if you had pressure feeling in your ear?
You asked me, and I said no. Maybe just slight if I do have any, which is very minimal.
Would it be in the left ear?
Yes.
Same on that. Okay. Alright. In terms of your nose, have you noticed any abnormal bleeding?
Mm-mm.
What about obstruction?
No.
Have you noticed any like polyps or masses?
Mm-mm.
Okay. Have you had any excessive like runny nose?
I've had some running nose.
Okay. And when you are blowing your nose, what color is the snot that's coming out?
It's pretty clear.
Okay. Do you have sinus pressure?
No.
Have you been sneezing excessively?
Yes.
Okay. And have you had changes in your sense of smell?
Mm-mm.
Okay. Last set of questions. Have you had mouth pain?
No.
Have you noticed bleeding in your mouth?
No.
Okay. Have you noticed that you've been hoarse?
Yes.
Okay. And how long have you felt like you've been hoarse?
Probably this last week.
Okay. Have you noticed abnormal bad breath?
No, not that I know of.
Okay. Have you noticed any masses or lesions in your mouth?
No.
And I know you said you have a sore throat, that's why you came to see us. Have you noticed any abnormal snoring?
No.
Okay. Have you had changes in your taste?
No.
Have you noticed any ulcers in your mouth?
Mm-mm.
What about an abnormally dry mouth?
Mm-mm.
Okay. Alrighty, now we're going to talk about your past medical history. So to start, have you ever been hospitalized?
Once I got my left ovary removed.
Okay. And what year was that?
2017.
Do you remember where you got that surgery done?
Auctioner.
Where?
Slidell.
And other than that, have you had other surgeries?
Well, I had
No, that's okay.
my ear tubes removed
In both ears or one?
Both.
Okay.
when I was a baby. I had
Okay.
tubes.
Did those tubes fall out on their own?
Mm-hmm.
Okay.
I'm gonna say I had them put in. Whatever that works whenever you're...
And then you got them, they fell out on their
Yeah.
own? Okay.
Yeah.
And how old were you when you got them put in?
I honestly don't know.
That's okay. Are you up to date on your childhood immunizations?
Yes.
Did you get your flu shot last season?
Yes.
Are you on any medications right now?
Have an IUD.
Okay.
That's it.
Do you have any allergies?
Mm-mm.
Anything seasonal that you know of?
I do get seasonally sick, but nothing that I don't know, maybe pollen a little bit.
Mm-hmm. But you're not diagnosed with any
No.
allergies?
No.
Okay. And do you have any medical allergies, food allergies?
Nope.
Any, like, animal thing?
Nothing at all.
Okay. And now we're going to talk about your family history. So when I say family, it's going to be you, well, your mom, your dad, and your siblings. So to start, are both your parents still alive?
Yes.
All right. How old are they?
They're 54 and 56.
Which one is 56?
My dad's 56.
Okay. And do you have any siblings?
Yes, I have 4 siblings, or 3 siblings. I'm the 4th.
Okay. Can you go in order for me?
Sister's the oldest. She's 31 if you need to know any of that.
Mm-hmm.
Then my brother, he's 29, and then my other brother is 25.
Okay. And then you're the baby.
Mm-hmm.
Okay. And so in terms of mom, dad, and your 3 siblings, is anyone diagnosed with hypertension?
No.
What about diabetes?
No.
Oh, this is mom, dad, and you. So stop me if anybody had this. So have you had hypertension?
No.
What about diabetes?
No.
What about high cholesterol?
I do.
You do? Okay. When did you get diagnosed with that?
I think I was 17.
Okay.
And then when I was 10, it was on my labs.
Okay. Has anyone been diagnosed with heart disease?
No.
What about, has anyone had a stroke?
No.
Does anyone have cancer?
No.
And has anyone had a heart attack?
Mm-mm.
Very healthy family. All right, now we're going to go into what we call your social history, and I just want to preface this by saying everything I ask you is just to be able to take the best care of you. There's no judgment. So to start, do you use any kind of tobacco products?
No.
Do you drink alcohol?
Yes.
Can you tell me about that?
I occasionally drink on weekends.
But how many days a week would you say?
1 or 2.
And what are you drinking?
Anything between wine and hard liquors.
Okay. And when you're drinking, how many drinks would you say you have?
Good question. Like 3 or 4.
3 or 4. All right. Do you use any recreational drugs?
No.
Can you tell me a little bit about your diet?
I try to eat healthy, but that doesn't always happen depending on school.
Mm-hmm.
So usually I eat meat and vegetables every day, but sometimes I eat fast food, maybe like once or twice every week or 2.
Okay. And do you exercise?
Yes.
How many times a week?
3 or 4.
And what are you doing when you exercise?
I like to lift weights.
Cool. Are you currently employed?
No.
Do you have health insurance?
Yes.
When you're prescribed medication, can you typically afford it?
Yes.
Okay. And what's your living situation like?
I live with my roommates at school. I have 3 roommates.
Okay. Do you feel safe at home?
Yes.
Okay.
One of them's a little crazy, but besides that.
But you feel safe?
Yes.
Okay, good. And then, are you sexually active?
Yes.
And I know you said you have an IUD. Is that the form of protection that you use?
Mm-hmm.
And have you been tested for STIs?
Yes, but I don't have any.
All right, Sabrina. So just to make sure we're on the same page, stop me if you think I need to know anything else. About 3 days ago, you started feeling like you have a sore throat. This happens seasonally, but it feels like it's not going away on its own this time, so you decided it was time to come in. It's about a 3 out of 10 on a pain scale. Nothing's really made it better. Spicy foods have made it worse. Have you tried any medication?
Just some cold medicine.
And what meds would that be?
The off-brand Equate.
Okay.
Cold flu.
Okay. So you tried some of that. Nothing has really made it better. It's on the left side of the back of your throat. Yeah, you said that your symptoms have been pretty vague. You feel some pressure, been sneezing, have some runny nose, feeling kind of fatigued from it all. Does that sound about right?
Mm-hmm.
Okay. Now we're going to move into the physical part of your exam.